Hello, Jokers. Thanks for watching this episode of Jokers Physiotherapy. So today, as you can see, we're talking about total jaw replacement. And what about it? I talk about it from physio's point of view. And so what is total jaw replacement? It replaces jaw joint or jaw joints, both joints, that is, with artificial joints. Now, these artificial joints are usually tailor-made, made to measure, so it fits into your temporal bone, as in the into your natural jaw joint shape. And this is an very effective procedure done by a very skilled professional maxillofacial oral surgeon who are specifically trained to do this sort of thing. But one of the surgeons said to me, it is quite a fiddly surgery, meaning it's a very small confined area and it requires a high level of skill. So, for example, where I live in Australia, on the eastern coast, eastern states, and in Sydney, there are only a handful of surgeons who are specialized in doing this sort of surgery. So it's not your everyday kind of surgery yet. And I just wanted to say that it is definitely effective. So effective in reducing pain. What sort of pain? The jaw pain related to chewing, talking, anything that involves your jaw and the mouth moving, even facial expressions. It could be very painful, and surgery for this will be a significant improvement in functions such as smiling, talking, chewing, so you can enjoy food, you name it. It is so far the positive effect far outweighs the possible side effects. You would only want to do any surgery. One, top priority would be to help reduce the pain or get rid of the pain. That's the primary focus of having the surgery or deciding to have the surgery. Now, at the outset, my views are skewed and biased because I only get to see clients who have had the surgery, who has been advised to have the rehab, specifically to improve certain things that are possibly still restricted or limiting post-operatively. So my views may be biased. And I'm sure there are many cases that post-operatively, the surgery has changed their life for good and for the better. At the same time, people report to me post-operatively, it reduces the total open range to less than 30 mil because they have an artificial joint, which obviously will have to be stabilized, but without the original ligaments and capsules, it'll have to be stabilized through the shape and the size of the actual joint itself when the replacing joints. So could be less than 30 mil, 3 centimeters, which is about, index and middle finger vertically oriented. That's about the tips or, the front top 2/3 of the finger width. That's about 30 mil or less. So you might not be able to fit that top to bottom on the front teeth post-operatively. What are the significance of that? Which may mean, not like this cat in the picture, you might not be able to yawn freely post-operatively or yell or bite into a big burger that's thick. You may need to squeeze it so you can start to eat. That's a small price to pay. Some people say, because the pain's so great, it just needs to have a surgical, improvement. Some people also say, due to the size of the replacing, what they call a condyle, or the joint itself, you may lose the sideway movements, which is also important, and possibly forward, but sideways can be lost, and that means the jaw is meant to have this rotatory grinding motion brought to your teeth to grind the food down to puree kind of situation of the food. But if you lose that sideway motion, you may lose that sort of rotatory grinding type of movement. Other times post-operatively, some people report to me is, when I'm brushing my teeth, I want to move my teeth a little bit, but it just wouldn't. So you have to use your hands a bit more. Losing forward and backward motion, that's not as significant, but yeah, it is a possibility. And I'm sure surgeons would have explained this to you before the surgery in many cases, if that's the case, if that's what the new replacing joint will have to be big enough to stabilize so that you may have not got that movement. And why do you have total jaw replacement in the first place? It could be because the disc inside the jaw joint, which is like a protector and it's a joint lubricant spreader, gets popped out. Whether that's because of previous trauma, which obviously pushed the disc out, and it's since then never the same because ligaments, muscles, tendons, and the disc may have been injured, or it's stiffened up over time because of the trauma in the past, or some dental procedures that went on for a very long time, things like that. At the same time, some systemic reasons are like thyroid hormone issues, usually in the form of hypothyroid, so there's not enough thyroid hormones. Somehow they tend to attack and inflame the jaw joints. Maybe that's because it's a closest neighbor. Who knows? We don't know the physiology, but we know that the antibodies tend to attack the jaw joint in the case of thyroid issues. Hyperthyroid can be a problem, but it's not as significant as hypothyroidism, such as Hashimoto's thyroiditis. So that's hormone related, but basically they both cause irritation, inflammation. When it's repeated, basically erodes the joint cartilage and wears down, which causes, yes, you guessed it right, arthritis of the joint. And it can inflame the bones of the joint, and that can cause massive, massive inflammation and significant level of pain, especially when the bone's bruised from arthritis. Swollen, that is, bruised, swollen. Also, previous trauma to jaw and face, obviously that can cause disc problems, direct injury to the cartilage or the joint surface, things like that. Other rare occurrence, but jaw ankylosis. So ankylosis means it just gets bone like stiffened up. So it can be bony or fibrous unions, which means the jaw joints, instead of moving two parts, the condyle and articular eminence, which is the temporal part of the temporal bone. And as you open and close, this spins, but in some cases it gets stuck, adhered to. Now this can be bony union. If it's a bony union, obviously you're not going to move much. You won't be able to open your mouth wide at all. Or fibrous union, where You get these adhesions in a fibrous way, which has some give, but obviously going to be very, very stiff and limited in terms of how much range you get into it. And if you're not enough range, then you're not functional, meaning you can't eat well, you can't yawn well, you can't talk well. So then you will definitely need some sort of surgical options. Now, before you get to this stage, you would have had months to years of symptoms on and off. So please, before you get to this terrible state where you may need to have surgical interventions to replace the jaw joint, please consult your doctor so you can be appropriately referred to the right person. If it's just a stiffness, an early stage, you may just need rehab, like what I do, physiotherapist, with a gentle stretching exercise program to keep your joint nice and mobile, keeping it functional. If there is any systemic reasons, such as those thyroids and other autoimmune conditions, like jaw ankylosis, then obviously you need to be referred on from the GP, general practitioner, or doctor to the specialists such as rheumatologists, or a hormone doctors like endocrinologists, who can start to look at and diagnose you early enough so you have less of these what we call associated conditions. Jaw is obviously an associated condition because the thyroid is not well controlled or autoimmune conditions not well controlled. So early intervention, have a chat to your doctors and see what they can they suggest. The earlier the better. It may not be just one time. You may have to be monitored over time before you go on to the next stage of treatment or being referred to, but earlier the better. It'll give you a sense of relief that it is something that you need to get onto, then you know what to do in terms of treatment, or there's nothing to worry about, that's cool too. But then if symptoms recur again, then you consult the doctor again and then being appropriately referred to for interventions. So thank you for watching this episode of Joker's Physiotherapy. Please let us know what you think in the comments below, or if you'd like to give us thumbs up. If you like these videos, please give us thumbs up, or please subscribe for future videos related to your jaw. Okay, happy rehab. Cheers.